Our show today is brought to you by Total Landscaping Inc., and they can take care of all of your landscaping needs, property maintenance as well, property landscaping, business landscaping. So check them out. If you need big brush removed, they take care of that. Total Landscaping, 764-3626. Cascades Family Night is coming up, and it's Wednesday night every week in the summer, and the entertainment is Karen Kidder and the Alibi Band. You've seen that band many times.
Oh yeah, many
Bert.
times.
It is free admission, sponsored by L. Rowe Steel. Check it out, Wednesday night.
Motoring over from Albion. Next on our show, we welcome from Brown's Advanced Care, Dr. Austin Brown. Good morning.
Hey,
Gentlemen, how we doing?
doing well.
Good to see you again.
Doing well. So school's getting ready to start. Ugh.
Yeah, that's crazy.
It's crazy, isn't it? It's amazing.
I just got settled into summer, man.
I know. So it feels like Bart and I were talking about getting ready for school.
Okay.
There's a lot that goes into it. If you have a child that's taking medication or a new medication, new school, you have to get familiar with the administration. I mean, there's a lot that goes into it.
There is a lot, and and it's really always a great idea to have a game plan with that kind of stuff. Yeah, especially if your child takes prescriptions and they're taking them during the day. Mm-hmm. If you're, parents that have been doing that for a little while are familiar with, kind of what schools need to have in order to get ready for that, especially if they need meds at school and the nursing team there takes care of that, or the office staff takes care of that. But if you're newer to that, or your child has started taking medications, really important now, if the schools haven't said anything already, start reaching out and saying, hey, I have these medications. What's the best way to go about doing this? What do you need from me? Yeah. Most of the time, the school staffs are really, really great about helping people manage that. Most of the time, and this is even something you can ask for at the pharmacy. If we're splitting up, day meds versus morning meds, and we've got, something, they need an extra bottle, extra prescription labels. If you ask the pharmacy teams for that, nice. They're really happy to help you with that. Another big one that we always look at is allergies.
Yes.
So, food allergies, allergic, reactions to bees or to what have you. If you've got EpiPens at home, those expire pretty much on an annual basis. Okay. So if you've got, EpiPens and things like that, check the expiration dates on your pharmacy label and the boxes. Those are something, hopefully you've never had to open that box and use it, but when they're there, when something happens, you want that thing to be ready to go. So make sure those EpiPens are good, make sure we got everything we need. This is a time of year also when everybody is getting back to school. Mm-hmm. Go figure, those things are hard to get.
Right.
Because everybody's trying to get them right. So the sooner you can get out in front of that, get that new prescription from the doctor if you need it, go to the pharmacy, talk to them, get those things around. So making sure you got all your ducks in a row, and if you have questions, call us at the pharmacy and we'll help you navigate some of that.
Yeah, and really for a child going to a new school that has a food allergy, for example, the school needs to be educated. You have to let them know that your child can't be exposed to peanuts or whatever the food allergy is.
Yep, exactly. And the schools, again, a lot of times the staffs are great about that. But if that's something new that you're experiencing, talk to your doctor, talk to your pharmacist. Who do we need to get on board to see? What should I have at home? What should I have at school? Another thing, cough and cold, restock that stuff. Checks the expiration dates in the cupboard, because school, man, they bring everything home.
That's right.
So we got to get ready for all that fun jazz.
I know we do.
I was up north, and I walked through quite a lot of brush and vegetation to get to the beach, and I think I was instantly stuffy and scratchy throat, coughing.
Oh, really?
You're allergic to the beach.
Yeah. Was it sand?
No. Wasn't there a clear
No, it was the vegetation. But instantly at night I felt it.
Did you get all right in here? Yeah. They keep coming all the time. So making sure that those things are stocked up at home, and just getting out for cough and cold and flu. And I mean, right now we still got COVID. I mean, COVID cases have ramped up around Jackson. We've been busy with that too. So that's another component for everybody. Especially kids at school too. your kid old enough to wear a mask? Are they, receptive to that? What are the school policies?
Right.
Just getting ready for those things. Thankfully, we're not in the giant conundrum that we were in. It's definitely it's much more manageable now, but still taking those precautions to make sure we're not bringing it home or sharing it with the classroom and doing what we got to do there. So
there's a new booster online for this fall too.
There is a new booster. Yeah, we're waiting on a couple more checks off the box from the federal regulations and ACIP and the powers that be, but there's a couple differences. The bivalent vaccine that is available now, the new one's not going to be bivalent. We're going after a specific subvariant of the Omicron, so we're not looking at covering 2 variants. That initial one now is not the one that's causing as much illness, and we're expecting that to be out this October before there's really wide scale availability. There's been some approvals, but we got to get our guidelines stamped out. A couple more of the federal regulations need to take a look at that, and then we're going to be getting ready to go. And we've had a lot of questions too, and this is very valid. Is all right. Well, there's a booster out now, and there's a new one coming out in the fall. I haven't gotten anything. What should I be doing about that?
Right.
So there's, and a lot of that is it's person to person, and it depends.
Sure.
For most healthy people right now, as a pharmacist, I would say if you've been doing well and you're taking precautions, right now I would say go ahead and wait for the new one.
Okay.
The one that we have available now, and the variants that we're seeing that are primarily causing the illness, it's not quite as effective as this other one's going to be. So if you otherwise, if you do get it and you had mild symptoms, probably okay to use over-the-counter remedies. We do have the prescription Paxlovid for people that are a little bit more high risk or meet certain criteria. But outside of that, for most folks, if you're generally healthy, I would say wait. Now, if you have immunocompromised status or other health conditions going on, and that's kind of a gray area, that's where it's, come talk to the pharmacist, speak with your doctor, and see if you need to have something on board, especially while we're seeing some uptick in the cases right now. But
yeah, and that's what really been a question that we've had. Should we do it now or should we wait?
Right.
It's kind of like, well, and the answer is, as you said, it's up to you.
It is. It really is a dependency factor right now. And those are still right now the boosters that we had for that second one are for adults over the age of 65. So not everybody's necessarily eligible for that second booster that we had, but it's an important discussion to have. I mean, we got just inundated with talk about vaccines, and we got so tired of it. We've actually seen vaccine numbers not just for COVID, but immunizations across the board have dwindled rather, which is disappointing because it's some of it feels like it was getting jammed down your throat, but it's an important aspect to remember. They're such an important piece of public health so that we all stay healthy. So I hope that people, if you do have questions or concerns, I always tell people at the pharmacy, it's like, this decision is yours and it's an important decision, but I'm here to clear the air about any questions that you might have, anything that you might be skeptical about or afraid of. I think everybody kind of knows what side of the fence I'm on. So it's like, but I'm not here to tell you that piece. That's up to you, but I want to help you make sure you're making the most informed decision that you can.
Yeah, it's amazing to have your local expertise. I wanted to ask you maybe a basic question about switching pharmacies.
Sure.
Is it as simple as selecting your pharmacy in my chart, or is there something that we need to do in advance? Someone call?
That's a great question. Yeah. So there's a couple different ways that you can go about doing that. So if you're using, if you wanted to come see us at Brown's and you're using a different pharmacy and you have active prescriptions that have refills on them, it can be as simple as you can call us and say, hey, could you please call this pharmacy and ask to transfer these prescriptions over to you? And then we'll pick up the phone and we take care of the rest of that. We'll gather your insurance information and we can, check to see what needs to be filled and go from there. Now, if you have certain medications like controlled substances, narcotics, sometimes the laws around transferring those prescriptions are different, or you might just need to call your doctor and have them send us a new prescription directly to the pharmacy, and then when it's time to fill it, we will fill it for you. Okay. And that happens with narcotic prescriptions and things like that. Independent pharmacies, I will say this from an insurance standpoint, the insurance companies don't always play nice in the sandbox with the independent ones, so there might be aspects, and it's an unfortunate thing, but we're having conversations with people depending on certain medications, particularly brand name drugs, we're running into situations where the insurance companies aren't even reimbursing the pharmacies the cost to buy them.
That's insane.
So we are seeing issues where people now, for certain types of drugs, the pharmacies are saying, unfortunately, you might have to send that one to a mail order facility because your insurance company won't even pay me for that.
That's crazy.
So depending on what it is, there might be a little bit more detail to go into, but in terms of transferring a prescription, generally a pretty straightforward process, and just call the pharmacy and we'll help you out.
Are we seeing any shortages of drugs right now?
We are, and unfortunately, it's not just one I can put my finger on. I have to talk about stuff all the time with drugs not being able to come in. There's a lot of supply chain issues, a lot of raw material shortages. Depending on where those drugs are manufactured around the world or in the United States, they can't get everything they need, or there's tie-ups with transport. So we are seeing drug shortage issues across the board, and I couldn't even tell you a specific one. So always important to ask your pharmacy, hey, can you get this? Is it in stock?
Well, we certainly appreciate all the insight and are happy that Jackson County has you here for all their questions. Dr. Austin Brown from Brown's Advanced Care. More of the morning show right after this.